Hello and welcome to today's program. I am Ogechukwu Ukekwe. Nigeria's House of Representatives has assured relevant stakeholders of its willingness to amend the Federal Medical Centers Act 2022 and to give accelerated passage to the 16 bills seeking to establish new federal tertiary health institutions across the Federation. Speaker House of Representatives Tajuddin Abbas gave the assurance in Abuja at a public hearing on 16 bills amended at establishing one health institution or the other in each state of the Federation, organized by the House Committee on Health Institution. The Speaker, who was duly represented as well, and other members lamented that the migration of health workers from Nigeria to other countries in search for greener pastures pose significant challenges to the nation's healthcare system.
Today's hearing, no doubt, is in line with the agenda, and so also I expect the outcome. Distinguished stakeholders, I wish to urge you to freely express their views, so opinions, either for or against the subjects of this hearing, in a manner that will bring about the sustenance of our collective will.
There has been an enormous migration of doctors, nurses, and other health workers in search of greener pasture in other countries, leaving Nigeria's health sector severely understaffed. The need to reposition the healthcare sector to meet numerous emerging challenges is critical to its improvement. To succeed in this era, a system that is well invested on human resource and medical intelligence as the bedrock of the healthcare sector is required.
The establishment of the college will further boost economic activities of the area where it is sited. The migration of health workers and the epidemics and their emerging trend underscore the need for Nigeria to have enough and an efficient health workforce that will be readily available when there are any health emergencies. This is the observation of the ministry and our position. The Federal Minister of Health has no objection to the establishment of the proposed federal tertiary health institutions. However, this should be based on merit.
The World Health Organization Regional Director for Africa, Moetsi, says the number of people living with diabetes in the African region is predicted to rise to 54 million by 2045, the highest projected increase globally if urgent intervention are not taken. Moetsi said this in her message to commemorate the 2024 World Diabetes Day, themed Breaking Barriers, Bridging Gaps. She said the rising diabetes prevalence in Africa is complicated by multiple drivers, including urbanization, unhealthy diet, and physical inactivity. She emphasized that managing diabetes requires a sustained effort to balance physical health activity, healthy diet, mental well-being, and the WHO in the African region is committed to holistic solutions, including proper nutrition, access to essential medicines, and mental health support. We'll take a short break and the program will return shortly. Welcome back. Diabetes is a serious health issue with millions of people living with the condition, many of whom do not know they have it. Type 1 diabetes is a genetic condition, but type 2 diabetes, which makes up the majority of cases, is largely preventable with lifestyle changes such as healthy eating, regular exercise, and maintaining a healthy weight. World Diabetes Day focuses on educating the public, promoting early detection, and encouraging healthier habits to prevent and manage the disease. Together we can make a difference by spreading knowledge, supporting those with diabetes, and working towards a healthier future for all. Well, joining me on the program to discuss further is the founder, Safe Through Medicals, and a public health enthusiast, Dr. Glory Alakba. Thank you for joining us on the program. So as a professional, can you briefly explain what diabetes is and how it affects the human body?
Okay, thank you very much for the question. Diabetes, or for the purpose of this lecture, it's diabetes mellitus we're talking about. But for this presentation, so I'll just quickly say diabetes. Diabetes is a metabolic disorder that characterizes, deficiency in insulin secretion, or there's insulin resistance, or the both of them happening together. And then this predisposes one to a state where we call hyperglycemic state, where there's a lot of sugar or a lot of glucose in the body that is not being able to, the body is not able to get rid of, or the body is not able to metabolize. So it's a metabolic disorder of basically on protein, glucose, carbohydrate metabolism, fat metabolism. That's it. That's diabetes.
So like we know there are two types of diabetes. That's the type 1 and the type 2. Can you explain their differences?
Okay, so type 1 diabetes, before we usually call it the insulin-dependent diabetes. This one has to do with autoimmune disorder of the cells that regulate insulin secretion and insulin production. That is the beta cells of the pancreas in the body. So autoimmune means that the body is fighting against itself. So this autoimmune disorder usually predisposes one to type 1 diabetes that we see in younger ages, as against type 2 diabetes that occur in older age group, 45 and above, or basically in adults. This type of diabetes has to do with resistance to insulin that is already available. The insulin that is available is not being utilized to drive glucose into the cells. And so that's the major difference between type 1 and type 2 type 1 and type 2 diabetes. So for type 2 diabetes, usually it occurs from lifestyle, from lifestyle, from some of them could be from genetic predisposition, but basically for type 1 diabetes, the major culprit or the major risk factor or the cause of type 1 diabetes is genetics. So for type 2, it's usually lifestyle and occurs in adulthood.
So how has the prevalence of diabetes changed in recent years, and what do you think is contributing to this increase?
Okay, so earlier, basically that would be for type 2 diabetes. Earlier on, before we used to see it as a disease of disease of the white man, disease of the rich, all that. But now, currently, we are seeing it's more prevalent in Nigeria. About 5% of the population have diabetes, as against before, where it's kind of a rare non-communicable disease that we see in our own climes, just because. And what predisposes one to this change is because of our diets, our dietary lifestyle. Now we've changed from eating our whole meal, highly nutritious food, to now eating junks and fully processed foods, salty diets. Many people now take alcohol, smoking, and then there's a lot of sedentary lifestyle now. So these are some of the things that, usually before, most of the occupation was, farming, hunting, and all these things that you're going to expend a lot of energy, people exercise and all that. But currently, we don't see that anymore. So these are part of the things that contribute to the high prevalence we see now in our climes.
So there are early symptoms of this disease, right? So what would you say are the symptoms, that's the symptoms and signs of diabetes that people should look out for? That's the early symptoms people should look out for.
Okay, so once you start having these excessive quests for water, there's increased thirst, polydipsia, then there's frequent increased urination, polyuria, and there's there's a lot of water you are going to urinate frequently, polydipsia, polyuria. Some people add, eating excessively, that's polyphagia. And then there's this unexplained weight loss. These are the cardinal symptoms that we ask patients. You have polydipsia, polyuria, polyphagia, and unexplained weight loss, coupled with having fatigue. Yeah, having fatigue, There's easy fatigability. You're always excessively tired. And then some people go into coma. Some people, become unconscious. There are other things that you look out for when you're becoming, complicated and all that.
What role do you think genetics play in the development of diabetes, particularly the type 1 diabetes?
Okay, so as I mentioned earlier, genetic predisposition or genetic factors are part of the things that influence one having type 1 diabetes, and we see it in younger ages. So if you have a family history or a first degree relative, first degree mean mother, father, or a sibling who has diabetes, like type 1 diabetes, you have a higher chance of coming down with the same, diabetes, type 1 diabetes, as against someone who has low risk of having this disease. So I would say that genetics play a very important role, even in type 2 diabetes. If there's a family history of diabetes mellitus in one's in an individual, that person has to, be careful on their lifestyle, have to get regular screening to prevent the complications or to prevent having diabetes.
So once diabetes has been diagnosed in an individual, what are the key strategies for managing it on a daily basis?
Sorry, I think you have to take the question again.
Once diabetes has been diagnosed on an individual, what are the key strategies for managing it on a daily basis?
Okay, so once one is diagnosed of diabetes mellitus, the first thing I would advise such a person to do is to identify a health facility where they can get specialist attention of an endocrinologist, that's someone who can manage the diabetes condition as a specialist. So they go to that kind of health facility, and then they are able to be there'll be close monitoring on this individual, and then they'll place them on treatment and tell them, okay, this is the lifestyle you should live now. If you are obese, you have to work on cutting down weight. You have to work on weight loss. You have to work on your diet. You have to work on cessation of smoking and reduction of alcohol intake, alcohol consumption, also regular exercises, and all this, and cut down on fatty foods or junks and that and all that. Cut down, a lot of things that you're going to do that if you stick to your plan of seeing a doctor, regular checkups and all that, you can be able to manage that long term. It's not a death sentence at all. It's not something that you say, okay, I get now and then I'm going to just die like that. If it's well controlled and managed, you will live, a quality life and all that. So very first advice I'm going to give anybody is to see a doctor that will keep monitoring the person, and then they have regular screening kits or regular check kits, the glucometer. They also have, their drugs. They take the drugs often. If they're on insulin, they also follow the insulin regimen as prescribed by their doctor and all that. So that's what I'm saying.
So in terms of managing diabetes, like you mentioned insulin, so what are the different types of insulin available for managing this disease, and how do they vary?
Okay, so once one is placed on insulin therapy, there are very serious warnings we give, or very serious or very important guidelines we give to ensure that this person does not abuse insulin and does not come down with complications of insulin therapy. So there are long acting or insulin, short acting, rapidly acting insulin, and so whatever it is that is prescribed for a patient according to the regimen by the doctor, that has to be followed, quickly. Because some of these patients, okay, we'll tell them to go back with their insulin at home. It's not something that we have to give them. Is they can give themselves giving self injectables to take this. They have these insulin syringes that they use. We teach them the measurements and everything. So whoever has whoever has been placed on insulin therapy, the doctor or the endocrinologist assigned to that person or who is seeing that person has the regimen. You can write it down for the person. The person follows strictly that regimen and has to be okay. Make sure you have food available before you take this. Make sure you have this. Make sure you have that. Because if you abuse or take this without the decision of the doctor and you just say, okay, I want to crash down my sugar and all that, hypoglycemia can set in and the person can, go into coma from there or, can die from that and all that. So insulin therapy is something that is very important that one has to go to their doctors and then be properly guided on how to use insulin.
So still on the management of diabetes, so can you explain what the AIC test is? Like, what's the importance in diabetes management, and what are the recommended AI targets for adults with diabetes?
Okay, so for the test that you should do, so now there's a screening test, and then if it's confirmed that one has diabetes, there are also some tests that are required that one should do. For the hemoglobin A1C, that's the glycated hemoglobin test that is done. This is done to monitor the glucose level of an individual over 3 months. It takes like, say, an average of the glucose monitoring of this patient or of the individual over 3 months. And the gold standard or the ideal thing to have is less than 6.5. So if you have more than 6.5 glycated hemoglobin, we are worried because that's diabetes, more than 6.5. And then if you do other tests like, okay, you have fasting blood glucose. For fasting blood glucose, we are worried, or you have diabetes if you have greater than 7 millimoles per liter. And then for random blood glucose, if one has more than 11.1 millimoles per liter. Or there's another test we do, 2 hours postprandial test, oral glucose tolerance test, with the use of 75 grams of glucose. If after 2 hours, we are still seeing that your blood glucose level is 11.1 millimoles per liter, we are worried because that's diabetes. And from there, we have to now start monitoring you. You have to come to the hospital to see a specialist so that we can avoid complications, because complications of diabetes, there are real adverse complications that could occur for patients with diabetes. So it's very important to follow up and get control. Because the thing about diabetes is sometimes you look healthy, you don't even have any problem, you don't feel any symptom, but it's there and it's causing slow damage to the system. And from that, you can end up having serious complications. So it's advisable that we always see a doctor. Once these values that I've mentioned, once you see that you did a glycated hemoglobin test and it is showing greater than 6.5, or you did a fasting blood glucose showing greater than 11 points, fasting greater than 7, then you did maybe a random blood glucose greater than 11.1 millimoles per liter, or 2 hours postprandial oral glucose tolerance test greater than 11.1 millimoles per liter. These values have been accepted, and if you get anything higher than these values I have mentioned, you know that, okay, yes, you have diabetes, which is not a death sentence. It is when you are, careless about it, you don't get it controlled. That's when we're afraid of complications.
So what are some of these complications that you mentioned that can arise from uncontrolled diabetes?
Okay, so for these complications, I'm going to break it down slowly. For acute complications, for the complications of diabetes, it's broad. So we have the acute complications, that's the one that can affect somebody suddenly, and it's acute. It's at the time there's something that can happen. It's rapidly occurring, and if nothing is done immediately, it's an emergency. If nothing is done immediately, there's problem. Patient might die, or patient might go into coma and all that. That's the acute one. And then there's the chronic complication of diabetes mellitus. So for the acute, we have hypoglycemia, that is low blood sugar. You might be like, oh, somebody has high blood glucose, and then that's hyperglycemia, and at the end of the day, still having hypoglycemia. So many factors can cause this. So some people might abuse drugs, insulin, and or their anti-diabetics drugs. They might abuse it and say, oh yes, I want to crash down my glucose and all that, and then that causes hypoglycemia. And then there's also diabetes ketoacidosis is an emergency. This is one of the complications, acute complications of diabetes. And this could lead to several things. Patient can come vomiting. Once this vomiting is occurring, several bouts of vomiting, nausea, ketotic breath, different things can occur at the same time, and then the patient passes out go into ketotic coma. Then there could also be HHS, hyperosmolar hyperglycemic state. In this state, you see blood sugar going as high as unrecordably. It's unrecordable. Sometimes the glucometer cannot pick the value of the blood sugar anymore, or the blood glucose anymore. It's unrecordably high. They begin to vomit as well, fever, infection can set in. These things can trigger, even malaria, all those things can trigger going into this state. If nothing is done, the patient can die from HHS. There are also other complications, acute complications that can come up from diabetes. But the one that is of concern, or the one that people just neglect because it doesn't really show, it goes slowly, is the chronic complications of diabetes, which could be vascular, that affect the blood vessels, or non-vascular. So for the vascular one, it could be microvascular, it can affect the tiny, blood vessels, or macrovascular, big things like the heart and all that. So for the microvascular, the small, tiny vessels and all that, it could go as far as affecting the eyes. That's why you see some people, because of diabetes, they go blind, because it goes to affect the retina. You can have retinopathy. You can have, and there could be nephropathy. It can go as far as affecting the kidneys. That's nephropathy. It can affect the limbs, neuropathy. So you begin to have, peripheral vascular diseases. You see some people that are diabetic, but they become amputees. They amputated their legs because they didn't take care of themselves. Once they have any small wound like that, it doesn't heal anymore. It doesn't heal fast, because you need blood, you need a favorable environment, you need oxygen, everything for wound healing to occur. But if the blood is full of glucose, the blood is slow, there's no mobilization of the cells in the blood to come and help healing, wound will not heal fast. And from there, infection can set in that leg. The leg will begin to get, necrose, or begin to die off. Before you know that, they tell you, okay, you can't use this limb anymore. It has to be amputated. That's because diabetes that you've neglected to control by taking your drugs or seeing a doctor can cause one to lose their limbs. Okay, so that's for neuropathy and peripheral vascular diseases. Now, for the macrovascular aspect, diabetes can lead to stroke. Very possible. It can cause stroke. It can cause cerebrovascular accident, which is stroke. It can lead to a lot of embolia and all of that. So if you have all these complications, it's very, very important that one sees their doctor immediately. If you see all these signs, see your doctor immediately, because the more you delay, the worse the outcome.
So there
are other complications. Yeah. So there are other complications. You can even go into depression. There are other things that could occur just from diabetes.
So does diabetes affect only adults, or can it also impact children? What are the typical age range of different diabetes, and what does the symptoms and management differ from children and adults?
Okay, thank you very much for the question. Yes, we can affect children as well. Most especially type 1 diabetes from the ages of 10 and all that. We see type 1 diabetes, which they have to be dependent on insulin for the rest of their lives. But type 2 diabetes, we usually see those ones in adults, because it's over time. It develops over time from lifestyle and all that. And then there's even also gestational diabetes caused in pregnancy. So all these ones can be seen in adults. And then for the treatment regimen, of course, it differs from that of children, adults, based on dosing and all that. and based on, the kind of therapy you might want to institute and all that. So for adults, you are more particular. That's what type 2 diabetes, you are more particular about lifestyle modifications. If the person does not change their lifestyle, no matter how you take the drugs and all that, you're just stressing your body the more. So for adults, we try to tell them to modify their lifestyle, regular exercises, cut down on their or like cut down on weight. That's a lot of weight loss regimen, weight loss journey, cut down alcohol. These things help to control blood sugar, cut down on fatty foods, on high carb or high calorie diets. Just eat diets in adequate proportion. Don't go overboard or and all that. Just have diet control and all that. So these are the things we tell people and adults.
So what role the public health campaign like World Diabetes Day, which was celebrated on the 14th of November, which was last week, play in increasing awareness and reducing the stigma around diabetes?
Okay, so it's very important we talk about diabetes because most people don't know that it could actually lead to some of the things that you mentioned, like blindness and all this. People see it as, oh, it's the disease of the rich, is this, it cannot affect me and all that. Or some people even see it as, oh, this person contracted the disease from somebody else and all that. It is non-communicable. It means if I have diabetes and I come into a room, I can't spread it to people. So it's these things, the awareness will help people know what it is and how they can prevent diseases, prevent diabetes. And also if they have a family history of diabetes, they can also quickly get screened, do regular screening and all that. So awareness is very important. Public health is important in the control and prevention of diabetes because diabetes is actually expensive to treat. It's expensive. The drugs are expensive. You have to do regular checkups. You have to go to the hospital. It's quite expensive. So if you can prevent it, why not? Prevention is definitely cheaper and better than cure. So that's the role public health play in, prevention of diabetes.
Well, founder, Safe Throw Medicals and a public health enthusiast, Dr. Glory Alakpa, thank you for lending your thoughts on the program.
Thank you. Thank you so much.
And that's all for today's episode. Thank you for watching. See you next time.